I'm Dr. Paul Bradley, and I'm a co-founder of Scripta Insights. I'm an internist, and I've been in practice for over 30 years now. I still see patients on a daily basis. In my younger days, when I was naive enough to think that I, the physician, gave the patient, a prescription, they would run to the drugstore and fill it. Well, I had this younger patient with very unusual, terrible hypertension. Blood pressures that were in the office, they were horrible. They were like 190, 200 over 110. And I wish I was making this up. I had her on 8 different medications, and the blood pressure was still horrific. I mean, in fact, it was actually worse. We were at over 200. And I told her, I said, look, I'm really worried now. I got to put you in the hospital. I'm worried you're gonna have a stroke or a heart attack. I know you're young, but these pressures are truly terrible. So I put her in the hospital, and we gave her 8 medications that she was allegedly taking. And literally just a few minutes after that, I got the call from the nurse. Well, we've got a problem. Her blood pressure has gone down to like nothing. So I remember rushing back in the room and saying, you swore to me you were taking all those pills. I know, Dr. Bradley, I know, but I really couldn't afford them, so I wasn't really taking any of them. Now you tell me. So yes, she was okay. And ultimately she left the hospital on 1 pill that she could afford, and her blood pressure did great ever after. And so the origins of Scripta were as simple as me saying, you know, there's got to be a better way here. And then came, as I was looking, the revelation that there are sometimes very expensive drugs, and there's sometimes very inexpensive alternatives. And the only difference is literally the ink that comes out of my pen. The early part of Scripta was as simple as me writing on a piece of paper in a matrix, and then we were plugging the numbers into an Excel spreadsheet. And I started telling people, you know, there's a lot of money that is on the table here. In the world of primary care, and for the most part in the world of medicine, doctors don't know the cost of medications. You think we do, but we're truly blind. Originally, it was just me sitting in that prescribing chair, but eventually I needed more help. And the really cool thing about Scripta is I was able to pull in specialists, and literally every medical specialist, whether that be cardiology, neurology, nephrology, every organ system, and put together Scripta's very special P&T committee that encompasses all the medical specialties, which allows us to look at not only every drug that is on the market and every drug that comes to the market, but look at it at the internist level, that 30,000 foot view, but look at it at the specialist level as well. Mindy and I made multiple visits to local companies and told our story. And honestly, at first we got very little traction. We got first 1 client and then a couple more, and we were proving, look, this really works. We can practice great medicine by simply thinking about the medication and its cost, the cost being such an important factor in whether or not the patient was going to be able to fulfill, you know, not just fulfill that visit's intent, right? Get that medication and take it. Scripta's come a long way, and we've continued to grow. We've left my little matrix and Excel spreadsheet to complicated computer programs that I'm simply in awe of. We now basically cover every medication, old and new alike, and we're always looking, searching. Prices are constantly changing, and our goal at the end of the day remains the same: getting the right meds at the best price for our patients.